Hey YouTube, it's Ashley and you're watching The Substance Project, where we work to bring you more than makeup tutorials and fashion hauls every Wednesday. Today's video is about helping you find out if your doctor is in bed with the big bad pharmaceutical companies. So prescription drug use in America has been getting a lot of media coverage over the last few years, and rightfully so. There are some pretty surprising statistics about our use of prescription drugs. To start, according to a 2013 Mayo Clinic study, 70% of Americans take at least one prescription drug. 50% of us take two. 20%, which is still a pretty significant number, take 5 prescription drugs or more. According to the study, antibiotics, antidepressants, and pain-killing opiates are the most commonly prescribed prescriptions. It's that antidepressant usage specifically that's really skyrocketed over the last 20 or 30 years. 1 in 10 Americans is now on an antidepressant, and among women aged 50 to 64, that number is 1 in 4. There's specific concern around the antidepressant usage that we have a general state of overdiagnosis and overtreatment of depression in the US. This is backed up by a separate study published in the journal Psychotherapy and Psychosomatics that found in a study of over 5,000 patients who were given a diagnosis of depression and treated with psychiatric medications, 2/3 of them did not meet the criteria for a major depressive episode. However, all were prescribed and used psychiatric meds. Now, this is no doubt a complicated issue and there are a lot of factors going into it. But one part of the story, one theory, is the rise in marketing spend by these big pharmaceutical companies in recent years. That rise may be contributing to this over-medicated state that we're now in. Now, there's 2 types of marketing from pharmaceutical companies. There's the direct-to-consumer, which is the nearly unavoidable television ads that you have surely seen time and time again. But there's also marketing that's done directly to doctors and our healthcare providers. And this is a marketing practice that's been getting recent media attention and scrutiny. Just this year, John Oliver covered this topic in his HBO show Last Week Tonight. If you get a chance, check it out. It's about 17 minutes, but it's really an interesting piece. And it left me wondering, is my doctor accepting payoffs? Has she ever recommended anything to me that I didn't really question? And is there an ulterior motive behind that recommendation? So I'm thrilled to share with you that you can answer this question yourself for your own doctor. And it's actually a compliment of our government. Open Payments is a federally run transparency program. It collects information about doctors and hospitals' financial relationships with these healthcare manufacturers. A relationship could involve money for research. It could also be money for gifts, for speaking fees, for meals, for travel. Regardless of the reason, this website will spell out exactly what that relationship looks like for your doctor. I was happy to see that my primary doctor collected exactly $10.84 in general payments in 2013, which were categorized as food and beverage and likely, an annual lunch brought to the office or maybe a platter of cookies. And I feel pretty okay with that. My eyes were opened a bit more when I searched for a local hospital where my dad had surgery last year. Now, this is a really prominent and renowned hospital. I have a ton of respect for it. But I was kind of surprised to see that they had accepted nearly $21 million in payments in 2014. Now, $17 million of that was categorized as research, but that still leaves over $4 million in general payments. For my hospital, that was categorized as royalty and license fees, charitable contributions, grants, consulting fees. I don't know enough about this to make a judgment, but it was really eye-opening and really interesting to see. And I think it's really empowering for you to be able to check this out yourself. So I'd encourage you to use the website to look up your doctor, look up your parents' doctor, see what it says, see how they compare to one another. And if you have questions, ask. Hope this was helpful and informative for you. I will link below to some of the research studies and John Oliver episode that I referenced. If you like what you saw here, please give us a thumbs up and think about subscribing to our channel to check out new videos every Wednesday. Thanks for watching and have a great day.